Today I'm going to share the best way to use supplements for your stubborn gut challenges, so stay tuned. Hey there, if you're new here, welcome. My name's Amanda Malacheski. I'm a certified functional nutrition health coach and a digestive and allergy detective. To learn more about how to find your personalized plan for calm digestion, please consider subscribing and be sure to hit the bell to be notified when I post a new video. Gut supplement use seems to cause a lot of confusion for those of you out there with gut challenges like bloating, gas, constipation, diarrhea, SIBO, IBS, reflux, whatever. So by the end of today's video, you'll learn the gut supplement use method that I teach my clients and students so that you can have some more confidence using these very valuable tools. My client Judy used this technique to create a customized support protocol to manage her chronic frequent diarrhea. And you can too, so let's get started. When I first got sick, I didn't really know how to use supplements at all. So much so that I reached out to a practitioner who gave me a supplement protocol that was based on a multiple choice questionnaire and gave me a list of like 15 supplements and said, here, just start taking these. And so I said, okay. And I went and ordered them all and started taking them. But this kind of didn't really end so well. There were some side effects. And then once that started to happen, I didn't know what was causing it because I hadn't done this method properly. And then later, as I was on supplements long term, I would be using supplements, but I wouldn't have an idea of whether or not they were actually helping. And I was, continuing to buy and take expensive supplements, which maybe weren't necessary for me. So I'm wondering if you can relate. Click like if you can relate. So here are some tips to help you get the most out of your supplements and supplement protocols, no matter whether you're using probiotics or enzymes or stomach acid or anything at all. Really, this could be generally applied to supplements, no matter what kind of health issue you are using them for. Tip number 1 is to start one supplement at a time. Just one. This is so important and may require a little bit of a mindset shift. But doing so allows you to get really clear on the impact or lack of impact from that particular supplement. And the idea is that you work with that one supplement until you find your ideal amount, and whether that takes a week or a month or whatever. Tip number 2 is to practice what's called titration, which is basically just starting with a small amount of a medication or supplement and working your way slowly up to the recommended or maximum dose, depending on who's recommended this therapy for you. So this involves using maybe a pill cutter to chop things up into smaller bits, diluting things in water, or opening up capsules and putting them into water or food to take them so you can take a smaller amount than a whole capsule. This tip especially applies to you if you are someone who is very sensitive and reacts sometimes negatively to supplements that you take. This technique saves you from terrible symptom flares. You start small, and maybe if you start to see a little bit of an impact, then you can stop or drop back. In other words, you want to practice what I call start low and go slow. You want to make that a mantra for yourself, no matter what kind of supplement or medication you're using. Tip number 3 is something that actually can really make a big difference for you in the long term, figuring out your case. And that is when you notice an effect, either a positive or a negative effect from a supplement or medication that you're taking, you want to work to understand the mechanism behind that side effect. You want to think about what mechanism can explain it. And the benefit of learning this information is it helps you understand what your underlying root causes are. And it can also lead you to even better strategies or supplements or treatments with the help of your doctor or other practitioner. So for example, if probiotics trigger diarrhea, itching, and headaches, this is a pretty good indicator that you may have a histamine intolerance, because those are symptoms that often happen with histamine intolerance, and probiotics and fermented foods, which are rich in probiotics, often trigger histamine problems. So once you know that that may be the case, then that really helps point you in a better direction with other strategies that you're going to try to feel better. Tip number 4 is to stop or reduce supplements that aren't working for you or are causing side effects or harm. And of course, if this is a medication, you'd absolutely need to speak with your doctor about reducing dosages for things, because that can have unintended consequences. But yeah, if your body is giving you clear signs that this supplement really isn't working for you and it's causing harm or negative side effects or impacts, it's absolutely okay to reduce it back to a level where it feels okay, or to stop entirely. I recently completed SIBO treatment, and I talk about it in this video here. And in that final round of SIBO treatment, I couldn't quite tolerate the treatment. I was feeling really bad towards the end of the round of antibiotics. And so in consultation with my naturopath, we stopped the medication a couple of days early. I got almost all the way through it, but not quite. And just every time I was taking it, I was feeling really bad. And so it's important to listen to that feedback from your body. It's telling you important things, and it needs to be listened to. And then tip number 5 is to only continue using supplements or medications that really are providing you with a noticeable benefit based on your body's feedback. Your body knows, and it will give you the feedback that you need as long as you are patient enough to listen to it. And this is a little bit on the flip side of the previous tip in number 4. But we want to just keep going with things that are really benefiting us, and not keep going if it's kind of giving us a negligible benefit for a high cost, for example. How have you added supplements into your life and your routine? Tell me about it in the comments. Ultimately, finding your ideal supplement protocol requires a comprehensive strategy to focus on the right things and make sure that you're using what's really helping and avoiding the things that aren't making things any better. And with a little bit of patience and time and trial and error, you can absolutely do this. So if you're struggling with not knowing how to use the various gut health supplement protocols and diets that you hear about online, I can help. My new 8-week online program called the Calm Digestion Method helps people who are confused and frustrated with their gut health diets and protocols go from anxiety, endless questions, and second guessing to a confident plan for calm digestion so they can live a flexible and spontaneous life again. We're starting the program back up on September 28th. So if this sounds like it could help you, please consider applying. You can go to confluencenutrition.com/contact and schedule a time and fill out an application for the program there, and I will be in touch with you. And I really look forward to meeting you and hearing more about your situation and to help you understand how I might be able to help. I hope that this video helped you fill in some of the gaps in your knowledge about how to use gut health supplements. If you like this video, please click like, please share it, and consider subscribing, and I will look forward to seeing you next time. Take care.